Magnesium and Calcification, Part 2. Dr. Karen Kubena, Associate Professor of Nutrition at Texas A&M University, indicates that even if you monitor your magnesium level closely, you're still at risk for migraines if your calcium level is not balanced. It seems that higher than normal blood levels of calcium cause the body to excrete excess calcium, which in turn triggers a loss of magnesium. Say you have just enough magnesium and not too much calcium. And too much calcium in your blood. If calcium is excreted, the magnesium goes with it. All of a sudden you could be low in magnesium, she says. If calcium is not taken with enough magnesium, it will cause more harm than good. The unabsorbed calcium can lodge anywhere in the body and provoke practically any disease. For instance, if it lodges in your bones and joints, it leads to some forms of arthritis. If it lodges in your heart, it leads to arterial lesions. If it lodges in your lungs, it provokes respiratory problems and more. Despite the crucial relationship between calcium and magnesium, a recently published study announced that most U.S. children don't get enough calcium in their diets. It's more like it's just not being absorbed right because of no magnesium. And pediatricians should intervene to help remedy the problem. These guidelines were issued February 2006 by the American Academy of Pediatrics. The proportion of children who receive the recommended amounts of calcium declines dramatically after the second year of life, reaching a nadir during adolescence, said Dr. Nancy F. Krebs of the University of Colorado in Denver, head of the Academy Committee that wrote the guidelines. Adolescent girls are faring the worst, Dr. Krebs and colleagues reported. Only about 10% of girls ages 12 to 19 are getting the recommended amount of calcium. For boys, the figure is about 30%, according to the guidelines. Not a word is mentioned about magnesium, as the committee goes on to recommend increasing calcium intake through the use of fortified foods and calcium supplements. Is a medical crime being committed when these pediatricians fail to address the crucial relationship between magnesium and calcium? Our affirmative answer is sustained when reviewing the materials presented below. According to the University of Florida Shands Cancer Center, a high level of calcium in the blood, called hypercalcemia, may become a medical emergency. This disorder is most commonly caused by cancer or parathyroid disease, but underneath the primary etiology is probably magnesium deficiency. Well, of course it is. Hypercalcemia is commonly attributed to either the cancer treatment or the cancer itself, and may make it difficult for doctors to detect hypercalcemia when it first occurs. Of course they're not going to catch it. This disorder can be severe and difficult to manage, especially because doctors have not a clue about the underlying relationship between excess calcium and low levels of magnesium. Severe hypercalcemia is a medical emergency that can be avoided if magnesium levels are brought up to normal. Calcium competes with zinc, manganese, magnesium, copper, and iron for absorption in the intestine, and a high intake of one at the same time can reduce absorption of the others. Okay, that's something I'm going to memorize immediately. Because of the totally distorted way medical science relates to magnesium, the medical profession makes mistakes with calcium recommendations. It's still common to hear the assumption about calcium's ability to help prevent osteoporosis, weakening of the bones usually associated with aging. The fact is that increasing magnesium intake increases bone density in the elderly and reduces the risk of osteoporosis. I hate it when they use the word risk. It's development. When you use the word risk, it almost implies as though it's something that just will automatically happen without actually having developed for a long time first. Higher magnesium intake through diet and supplements was positively associated with total body bone mineral density, BMD, in older white men and women. For every 100 milligram per day increase in magnesium, there was an approximate 2% increase in whole body BMD, said Dr. Catherine Ryder. Remember that, all right? Now that is something that you cannot attribute to placebo. In a 1933 work, Vital Facts About Food, Otto Kark, C-A-R-Q-U-E, wrote, "Bones average about 1% phosphate of magnesium, and teeth about 1% phosphate of magnesium. Elephant tusks contained 2% of phosphate of magnesium, and billiard balls made from these are almost indestructible. The teeth of carnivorous animals contain nearly 5% phosphate of magnesium, and thus they are able to crush and grind the bones of their prey without difficulty." Unquote. Some people, like a spokesperson for the UK-based charity the National Osteoporosis Society, continue to think, quote, "Magnesium deficiency is, in fact, very rare in humans." Eugenicist. So they cannot get it through their heads that magnesium deficiency, not calcium deficiency, plays a key role in osteoporosis. It is no surprise when we find more studies suggesting that high calcium intake had no preventive effect on the alteration of bone metabolism in magnesium-deficient rats. Citation given, of course. And that not only severe but also moderate dietary restriction of magnesium results in qualitative changes in bones in rats. No offense, but is this starting to sink in yet? The results from some of these studies may be surprising to some. While we have no reason to question the importance of calcium in bone strength, we have plenty of reason to doubt the value of consuming large amounts of calcium as currently recommended for adults and young people alike. Dr. Lewis Barnett said at some point, "One of the most important aspects of the disease osteoporosis has been almost totally overlooked. That aspect is the role played by magnesium, of course. While most sources understand that calcium is important in the growth and development of children, little attention is paid to the role of magnesium or magnesium deficiency or the need to maintain the intricate balances of each and other nutrients as well." Back in the 1950s, Dr. Barnett examined the bone content of healthy people and compared it with the content of people suffering from severe osteoporosis. He found there was little difference among the calcium, phosphorus, and fluoride content of the bones of the individuals. The magnesium content in the bones of the healthy people, however, was 1.26%. That of the osteoporosis victims was 0.62%, or slightly less than half. Many years ago, Dr. Barnett conducted tests on 5,000 people and found that about 60% of them deficient in magnesium. Today we find the MIT placing that number officially at 68%. How is it that so many in the medical profession can ignore this clinical reality and go on pretending that magnesium deficiency in the general population is rare? The current focus on increased need for magnesium for calcium in a magnesium deficient population can easily push those already receiving adequate amounts of calcium in their daily diets over the edge into high levels, thus causing depletion of magnesium and related health problems. The American Diabetes Association, in the 2006 Guideline for Diabetes and Prediabetes, joined the pediatricians and do not recommend that magnesium is considered in any significant way when making treatment and nutritional recommendations. This is in the face of overwhelming evidence over the years that decades that magnesium is even more deficient in diabetics, and dietary recommendations are not combating the issue. This medical review is important exactly because large segments of the medical establishment are choosing ignorance in relationship to magnesium and calcium, thus misleading the public and letting them be ravaged by iatrogenic disease. Coincidentally, a situation where billions of dollars are made. Yes, coincidentally. Despite the fact that serum levels of magnesium are not the best indicator of adequate magnesium levels, because most 99% of it is not in the blood, some studies have shown that when magnesium deficiency was induced in humans, the earliest sign was decreased serum magnesium levels, hypomagnesemia. Over time, serum calcium levels also began to decrease, hypocalcemia, despite adequate dietary calcium and increased parathyroid hormone secretion. Usually, increased PTH, parathyroid hormone, secretion quickly results in the mobilization of calcium from bone and normalization of blood calcium levels. As the magnesium depletion progressed, PTH secretion diminished to low levels, along with hypomagnesemia. Signs of severe magnesium deficiency included hypocalcemia, low serum potassium levels, hypokalemia, that's the name for it, retention of sodium, low circulating levels of PTH, neurological and muscular symptoms, tremor, muscle spasms, tetany, loss of appetite, nausea, vomiting, and personality changes. Hypercalcemia can cause magnesium deficiency and wasting. Not can, will. It is medical wisdom that tells us that magnesium is actually the key to the body's proper assimilation and use of calcium, as well as other important nutrients. If we consume too much calcium without sufficient magnesium, or I would say even with, the excess calcium is not utilized correctly and may actually become toxic, causing painful conditions in the body. Hypocalcemia is a prominent manifestation of magnesium deficiency in humans. Even a mild degree of magnesium depletion significantly decreases the serum calcium concentration. The adverse effects of excessive calcium intake may include high blood calcium levels, kidney stone formation, and kidney complications. Okay, I gotta pause for a second. I'm noticing just a little bit of apparent discrepancy, or oddness. So you eat too much calcium, nowhere near enough magnesium, and you can and will experience both hypo and hypercalcemia. Apparently it's one and which then leads to the other. Hyper leading to hypo, I would think. Elevated calcium levels in the blood, I would think, are also associated with arthritic joint and vascular degeneration, calcification of soft tissue, hypertension and stroke, an increase in VLDL triglycerides, gastrointestinal disturbances, mood and depressive disorders, chronic fatigue, and general mineral imbalances including magnesium, zinc, iron, and phosphorus. High calcium levels interfere with vitamin D and subsequently inhibit the vitamins, hormones, cancer protective effect unless extra amounts of vitamin D are supplemented. I shouldn't have read that word supplemented. The word should be provided, because obviously sunlight is best. William R. Quesnel, author of Minerals, the Essential Link to Health, said, "Most people have come to believe nutrition is divisible, and that a single substance will maintain vibrant health. The touting of calcium for the degenerative disease osteoporosis provides an excellent example. Every day the media, acting as proxy for the milk lobby, sells calcium as a magic bullet. Has it worked? It has definitely worked for milk sales. However, for American health, it has been a disaster. When you load up your system with excess calcium, you shut down magnesium's ability to activate thyrocalcitonin, a hormone that under normal circumstances would send calcium to your bones," unquote. I can't believe it's only been 13 and a half minutes. That seemed like half an hour. I mean, that was so much information that we need to get out as far and wide as possible. I will not apologize for my outspokenness on this. When it comes to magnesium and calcium, neither can be divided from the other. One is not divisible from the other in terms of overall effect. They are paired minerals, yet it is magnesium that holds the overall key for their paired function. In truth, magnesium holds the key to life. It is, as the Chinese say, the most beautiful of all metals. It is a nutritional element that can and is used as a medicine to great effect by all who know of its beauty and power. And now you do. Somewhat.